Welcome to the TOIG News Update with today's TOIG Spotlight. Cuban healthcare has surpassed American healthcare. National healthcare is relatively new. It's only in the past few centuries that societies have understood the need for a nationwide comprehensive health program for its citizens. In 1847, the Massachusetts Health Insurance of Boston became the first insurer to issue sickness insurance. In the 1870s, the railroad, mining, and other major industries started providing company doctors. After World War II, every major industrialized nation, with the exception of the U.S., as well as many others, actively sought the health and well-being of all their citizens through directly enforced and controlled government policies. Looking at just two systems, we clearly see the various approaches developed. The Swedish healthcare system uses county councils as their nucleus, not the federal government. These county councils operate almost all services and levy taxes to finance them. The health and social welfare system in Britain doesn't use county councils. It relies on the federal government to provide publicly funded services for all its citizens and is among the government's top priorities. It's also supported by a great many voluntary social and health care organizations. When the World Health Organization, WHO, published their report in 2000, ranking the healthcare systems of the world, the major industrialized nations ranked high on the list as expected, while the poorer nations struggled towards the bottom. France was rated to have the best healthcare system overall, with Italy ranked second. The U.S., however, ranked no better than 37th, just 2 places above Cuba. This is significant for many different reasons. The U.S. spends more than any other system by far, yet still provided worse service than 36 other countries. In fact, the survey proved that the once vaunted U.S. healthcare system was on a continuous slide of degradation. Since its implementation, more people than ever before in the U.S., 45 million, have little or no healthcare. Recently, the automobile industry was asked to reduce or eliminate their healthcare altogether. At the same time, Americans are encouraged by Big Pharma and Big Clinic to keep them blameless for their failures, and the Americans obediently comply. While most of the world has been steadily improving their healthcare systems, the U.S. has been worsening theirs. President Nixon began the slide by approving the current HMO system because it would provide less medical care and more profit for the healthcare companies. His famous discussion with John Ehrlichman on February 17, 1971, described just how he applauded less health care for the citizens. President Ford did nothing to change the slide. President Carter completely ignored the issue. Presidents Reagan and Bush Sr. were more than willing to reduce government involvement with a perpetual revolving door between government regulatory agencies such as FDA, USDA, and others, and the chief officers of Big Pharma and Big Clinic. President Clinton used the old crony trick of bait and switch during his first years by assigning the First Lady to head a project that was obviously doomed from the very beginning. In reality, his job was to keep Big Pharma and Big Clinic in big bucks. President Bush never bothered even faking it, and President Obama shows just how impossible it is to change status quo. Today, Americans have completely removed the patient from the Senate investigation equation, and now rely solely on Big Pharma and Big Clinic to tell them how much more the taxpayers need to spend for less service. Cuba, on the other hand, has been hampered in every aspect of its health care by an immoral American economic embargo that is meant to do one thing and one thing only: punish Cuba for not having an American-friendly government for the past 50 years. That punishment has been brutal, constant, and across the board. No part of Cuban life has been spared from the effects of the immoral U.S. economic embargo, and this is especially true of their healthcare system. Yearly, the U.S. spends tens of thousands of dollars per person on their failing American healthcare system. Cuba, on the other hand, can manage only $186 per person. The difference is night and day. The U.S. builds beautiful offices, major clinics, state-of-the-art hospitals, and massive computers with the most modern databases and software programs found anywhere on planet Earth. Cuba has to content itself with Cardex systems, small compact offices, and few modern equipment. The fact that Cuba can even come close in any comparison is shocking. But for Cuba to have a better system than the U.S. is tantamount to saying that Gilligan has just beaten Admiral Nimitz in the War of the Pacific. The United States policy towards health in Cuba has explicitly been aimed to deny and undermine the revolutionary government's attempts to improve the health of the population. Through economic blockade and sabotage, through chemical and biological warfare, and through outright invasion and subversion, the United States has for over 40 years pursued its goal of destroying the threat of a good example that Cuba's successes in health and social justice provide. There are no homeless in Cuba, while in the U.S., an ever-increasing burden of over 2 million homeless people, rising with up to 25% of them being U.S. veterans, now populate their country. There are over 50 million people in America without health insurance, but in Cuba that number is 0. One can only wonder what incredible heights Cuba would be capable of reaching if ever the U.S. lifted its immoral economic embargo and allowed the surprisingly innovative Cubans a chance at a fair and even playing field. Indeed, the whole world should take notice of the gigantic feats Cuba has performed, while the front foot of oppression has been keeping them in a virtual economic stranglehold for half a century. For the Toig News Spotlight, this is Toig.